Hi, Dr. Greg Guyman here. I wanted to spend a couple minutes talking about Airway and orthodontics. Over the past few years, there's been a lot of studies and a lot of research done in the area of airway and what kind of influence orthodontists can have in evaluating airways and treating both children and adults for airway issues. Now, for those that don't realize, airway has all kinds of problems that can be associated with a problematic airway. For example, kids who are chronic mouth breathers and are unable to breathe with their mouth closed, and they tend to grow with longer faces. So the airway actually changes the growth pattern, creates a less attractive facial structure because it creates a longer face. Now, airway problems can also cause everything from bedwetting to symptoms like restlessness, ADHD type of symptoms, lack of attention. So we see all kinds of issues with airways. For adults, the most common problem with airways is obstructive sleep apnea, which can even be a deadly problem, is treated with a CPAP in most cases. These are all situations that an orthodontist can in fact influence. Doesn't always solve it without help, and it's usually done with the help of other specialists. But I'll show you here one specific problem that we often notice in our younger patients, and that is enlarged tonsils and adenoids. Now, pediatricians, by and large, are not evaluating airways like they did way back in the day, and so less and less kids are getting sent to an ear, nose, and throat doctor to have tonsils and adenoids removed. Now, for me, that is unfortunate. I am a big fan of having tonsils and adenoids removed, especially in the presence of airway issues. And so here's a classic picture of an airway, and you can see that air flows both through the nose and through the mouth, and airway can be obstructed both here. This is where the tonsils grow, and I'll show you a picture there. Can be obstructed here, both with position of the tongue and the size of the arch, which we can talk about expanding arches to create a larger airway, and of course clear down here. So there's multiple areas where this airway can get constricted, and in any of those points can cause problems such as obstructive sleep apnea, such as mouth breathing. And so anytime you're not getting enough air, you're going to do something, either you're going to have lack of oxygen in your bloodstream, or you're going to open your mouth and cause irregular facial growth pattern. So lots of problems associated with airway issues can be treated. So let's show what happens with enlarged tonsils. This right here is this is an overgrowth of tonsils, inflammation. And you can see right here, this kid, I can guarantee he's a snoring kid at nighttime and is probably breathing through his mouth during the day. All kinds of problems with that. And so this is something we like to get an ear, nose, and throat doctor involved in. We usually have those tonsils and adenoids removed, sometimes just tonsils, sometimes just adenoids. But we also usually get into placing an expander to widen the palate. Between removing tonsils and creating a broader palate can completely change the way a kid breathes. Our office, we don't charge for our initial visit. I'd love to have you come in and let us talk to you a little bit about how we can help your child breathe better.